Hello and welcome to Joan Comrie's Feeding Tips. My name is Joan Comrie and today we're going to talk about technique for spoon feeding. So why do we need a special technique? Well, remember in past videos when I said what you put in your mouth can affect function. So I'm going to add to that what you put in your mouth, what the texture is, and where you place things in your mouth can affect function. So what do I mean by that? What I mean is that the way you put a spoon in a baby's mouth can influence the way the baby uses the tongue. And why would we want to influence that? Well, we want to start training, which is what spoon feeding does, is start training the baby the correct tongue patterns to swallow more solid foods. So we're going to start with something more thin, and then progressively you're going to thicken it, and as you do that you're going to train a stronger, more effective tongue pattern for swallowing. So and this is a technique I used with my 3 children, and when I was feeding my babies out in public, people would come up to me and say, "Oh my goodness, how are you able to feed your baby without such a mess and without a bib?" And now, not that I'm saying that feeding should not be messy, because I totally feel like feeding should be very much about an exploration of sensory processing, and we'll talk about that on another video. But what I'm talking specifically about is that I was able to train my children to have the most effective tongue patterns, that they did not push their food out of their mouth and they did not have any leakage or recycling, so there was no need for a bib. And that is a technique that I'm going to teach you today that you can use with your child as well. So hopefully, and if you haven't, I want you to stop the video right now and go listen to them. Hopefully you have listened to the video on readiness cues for your baby, what spoon to use, and what texture to start with. So I'm going to assume that we're all on the same page and we all understand that information. So what you're going to do with your baby, and goodness gracious, did she get to be 6 months already? She was just a newborn not too long ago. So what I want you to do is take your spoon and just dip the front of it in the baby food and in your puree. And when I say baby food, I mean any kind of puree. So I know a lot of moms are making their own food, and I think that's absolutely awesome if that is something you're able to do. So dip it in that puree and get the bottom of the spoon coated as well. And what you're going to do is you're going to bring the spoon in the baby's visual field, and you're going to wait for them to open their mouth. Now, if they don't open that mouth nice and wide, I want you to tap either the top lip or the bottom lip. And if you tap the lips, what that does is say, "Knock, knock, I want to come in," and hopefully the baby will open the door, which is their mouth, and you will be able to get the spoon in. So let's assume that baby opened her mouth super nice and wide, and what I'm going to do is put the spoon straight in right on the middle of her tongue. And once I've done that, I'm going to put a teeny bit of weight on it, and I'm just going to wait for baby to activate her tongue. Now, if she doesn't activate her tongue, I'm just going to wiggle the spoon a little tiny bit on her tongue, and I'm going to wait for the top lip to come down like this and clean the spoon. And once I see that, then I'm going to pull the spoon straight out. Now, the old-fashioned way to feed a baby is to bring the spoon in and scrape it off on the alveolar ridge, that ridge where the teeth are going to come in, or the top lip. So what happens if you do that? Well, if you do that, you're training your tongue. Let's visualize. Let's pretend you have something on the back of your teeth. And if you're a baby, you don't have the teeth yet, probably, if you're spoon feeding. But it's back up there, so how are you going to get it? Right? You're going to push that tongue out, and you're going to push out your food, and then mom's going to have to scrape it and put this food back in and scrape and go back in. How many times do you see parents feeding their baby that way? That is a really ineffective way to train correct patterns, because really what you're training is your tongue to push out. So let me clarify it one more time. So put a little bit of baby food on the spoon, and on the back of the spoon, you're going to bring the spoon to baby. If baby doesn't open the mouth right away, tap the top or the bottom lip, bring the spoon straight in, bringing 3/4 of the spoon into the mouth, so you've got almost the entire spoon on baby's tongue. Just wait for baby to activate their tongue. Once they do that and the lip comes down to clean the spoon, just pull the spoon straight out. Now, baby is not going to be able to clean a spoon the first few times that you try it, and that's okay. We are not feeding for calories at this point. We are feeding to train correct patterns. If you scrape on the roof of the mouth, you're teaching the baby to push that tongue forward, and you're going to be recycling and scraping and having a big mess, and you're training the wrong patterns for spoon feeding. So try these techniques, and if you're having any difficulty, one of the next few videos will be on problem solving some of the difficulties that I see in feeding therapy with spoon feeding, and if that becomes even more complex, it may be time to get some professional help. I hope this was helpful. Please continue to share these videos with people that you know that it may help, and continue those comments. I really enjoy having that comment and the interactions with you. And again, remember, you can always give me good reminders or good ideas of what to do next. Thanks.